Traumatic brain injury and post-traumatic stress disorder are becoming the signature injuries of the Iraq and Afghan wars. With symptoms like depression, irritability, hypervigilance, short-term memory loss, and difficulty sleeping, affected vets have trouble doing the simplest things. But now some vets are finding help in an unusual way. News Channel 7's Meredith TerHaar joins us to explain.
A treatment developed to cure the bends in divers is now being used to heal the brain and cure vets suffering from post-traumatic stress disorder that resulted from traumatic brain injury. When Sergeant Joshua Cope's Humvee was hit by an IED in Iraq in 2006, his external injuries were apparent. He lost both legs in the blast and badly injured his right arm. But it was the unseen injury, the damage to his brain, that went virtually untreated.
I was depressed, I guess you'd say, just not looking towards the future.
The same was true for combat controller Brian Schieffer, who after 3 deployments was injured when his Humvee flipped during a training exercise in Fort Irwin, California.
Not being able to concentrate on anything, whether it was work or school or answering something as simple as an email, feeling just, anxious, kind of on edge all the time.
The injury that most of these, well, actually all of these people, has been shown to be injury to the white matter of the brain, where there are many fibers that conduct impulses, and there's a shearing action, and so therefore the brain is not completely connected with the other parts because the fibers have been sheared.
Schieffer says the VA told him there was no treatment.
They wanted to put me on medications, and that was what I was totally against, just because I don't take any pain medications, for anything else.
Dr. Eddie Zant treated both men for free at his hyperbaric oxygen therapy facility in Destin with a series of hour-long treatments.
The hyperbaric will actually repair the injuries to the brain. It will stimulate stem cells to the injured areas, increase the blood flow. There are some neurotransmitters that are out of whack from the injury. It will repair those. If the DNA, which is the makeup of the gene, can be fragmented, it can repair that.
Typically, your blood oxygen level is about 95. Inside one of these chambers, 100% oxygen is pressurized, pushing that oxygen into the liquid part of the blood. They can get the levels up to 1,500, even 2,000, and the benefits come over a series of treatments.
After about 40, I started noticing a huge difference. We did another 40 afterwards, and I honestly feel like I'm almost back to myself before the accident. I went from feeling, anxious, depressed, just mood swings, not being able to concentrate on anything, to having my life back again.
It's much more mellowed out and social and getting along with everybody and enjoying life.
I started my own business since the treatments. Just doing something I like to do.
But the VA does not currently cover hyperbaric oxygen therapy, leaving the treatments, which cost at least $175 a piece, out of reach for so many.
They would rather pump the pharmaceuticals into these guys instead of actually curing what is ailing them. It just blows my mind.
When we spoke to the Regional Office of Veterans Affairs in Biloxi, we were told HBOT is not even being considered as treatment for TBI and PTSD. We called the office in Washington, D.C. to find out why, but no one has offered a response. We'll keep trying. In the meantime, Joshua Cope and Brian Schieffer are still realizing lasting benefits from the treatments. Meredith TerHaar, News Channel 7.